hello everyone, and welcome to this audio podcast. This audio podcast is part of the Haemotoxy. This audio podcast is part of the Bostics and Baraga. This audio podcast is part of the specials. This audio podcast as part of a Storm Lobostic. This audio podcast is part of a Storm Lobostics production. So in this audio podcast, looking at some methodology now, some aspects of methodology in our works that's attributed to science student M Hussain, who has M Hussain as part who is a science student within an academic institution within the United Kingdom. So in as part of this audio podcast, a little bit in around the methodology to determine tuberculosis in around a patient case that science student M Hussain sort of investigates or looks to investigate. So, to establish whether or not the patient case has been infected by tuberculosis, a tissue sample or specimen from the patient was attained by a clinician through a pulmonary lobectomy procedure. And in order to identify the the sort of pathological changes, or sort of the histopathological changes caused by TB or tuberculosis, the specimen first had to be processed. And so processing prepares sort of tissue samples, histopathological samples or specimens for investigation, and requires or tends to require several stages. So, for example, there's a basis in around where histopathological specimens undergo sort of a basis of fixation, a basis of dehydration, a basis of clearing, a basis of embedding, and a basis of sectioning, and then when the histopathological sample or specimen and then undergoes initially H&E or hematoxylin and eosin staining, and to additionally inform viewers and listeners that H&E hematoxylin and eosin staining is for the majority of histopathological specimens and specimens in as part of laboratory in a part of laboratory investigations, as part of sort of in the midst of laboratory investigations. H&E or hematoxylin and eosin staining is one of the primary or primitive sort of laboratory staining investigations that sort of take place. The pulmonary lobectomy specimen used as part of this particular investigation and works by and where science student M Hussain looks into is a specimen that is used within the investigation had already been processed and where hematoxin and eosin staining had been utilized before additional selective investigatory investigatory histopathological staining. So that draws this audio podcast to a close. The next audio podcast will go into a bit more detail, or a bit more basis the elements or basis of the tissue histopathological tissue processing procedure in as part of this in as part of other works of Hussain, who investigates M. tuberculosis on this as part of the investigation of the patient case that was suspect for the condition. So that draws this audio podcast to a close. This audio podcast is part of the Haemotoxy. This audio podcast is part of the Bostics and Boraga. And this audio podcast is part of the specials. This audio podcast is part of the Express and Caliburn. This audio podcast is part of a Storm Lobostics production.